Good afternoon. My name is Donna Joseph, president of Alpha Kappa Alpha, Sorority Incorporated, Eta Omega Omega Chapter, Bronx, New York. Breast Cancer Awareness Day is one of many of our impact days where we educate, engage, and empower communities to various health matters, concerns, and disparities in various urban cities. This is also an opportunity for us to increase awareness of the disease. This year, we will be collaborating with Sisters Network, a group of women, breast cancer survivors who are also passionate about educating about the disease. On behalf of both organizations, Sisters Network New York and Eta Omega Omega Bronx, New York, we welcome you to our Breast Cancer Awareness Day. At this time, it is my pleasure to turn it over to our co-chairman and moderator, member Nijah LaCourt.
Good day, everyone. The first panelist that will be speaking is Levette McEachin. She's a two-time breast cancer survivor, president of Sisters Network, New York City, and her favorite motto is, "Life is very short and you have to learn how to live, love, and laugh."
Hi, my name is Lev McKitchen. I had breast cancer twice. Once 2007, 3A, stage 3A breast cancer. I had a lumpectomy, and once again in 2018, I received a diagnosis of breast cancer again, and I had the transplant. Both times it was very difficult doing the chemo and radiation, but thank God I'm here, I'm surviving, and I'm living. And this is why I decided to join the Sister Network to educate women about breast cancer and not to be afraid of the diagnosis. We will survive.
Our second panelist is Neila Charles. She's also a breast cancer survivor, author of Mama Afro is a Soldier Too, Mom's Cancer, Diagnosed, Explained, and vice president of the New York chapter of Sister Network, Inc.
Hi, everyone. My name is Nyla Charles. I was diagnosed with breast cancer in 2017, and I'm also BRCA positive, which means that BRCA2 positive, actually, which means that I have a mutation of a BRCA gene that predisposes me to a higher risk of breast cancer, ovarian cancer, and a few other cancers. With respect to breast cancer, I actually had I did chemo, I did a double mastectomy, I did chemo, I did radiation, and then I'll speak a little bit more about it later on. I'm also a mom of two little girls, so it was very difficult when I was diagnosed, but I got through it. And the reason why I joined Sisters Network is to just give some, just to be part of and contribute to raising awareness of breast cancer and breast cancer options and education and increasing health literacy in the African American community.
Our third panelist is Dr. Margarita. She is a registered doctor nurse of practice, clinical professor, adjunct professor, founder and CEO of Dr.Registered Nurse Success Academy, LLC.
My name is Dr. David. I'm so glad that I was invited to this forum to basically celebrate, right, our breast cancer survivors, because that's what ultimately is the most important piece, but also to serve as someone that can educate you more on what is breast cancer. So I'm very thankful that you've invited me to this forum. Yes, I recently opened the Dr.Registered Nurse Success Academy to basically mentor and tutor and guide all nurses, professionals in their careers. But I love doing these forums because I really get to social network, like socialize with others, and also get to know patients in the community. So thank you for inviting me.
Later on, we'll be having a video on self-breast exam and a survivor collage later on. First question I will be asking Dr. David. What is breast cancer? What is the female breast made of?
your breast has different things. It has ducts, connective tissue is made out of fat, lobules. So if you've had babies, if you've breastfed, that, you know, those ducts, those are the ones that with the mammary glands that are going to help you produce that, give that milk to that baby. But it does have a lot of fat tissue, and that's a big component in addition to the fat tissue that you have in your body, that can put a person at higher risk of breast cancer.
What is breast cancer?
So basically, breast cancer are cancer cells, or cells that go crazy and they just start reproducing. But these are not the nice cells that we want to reproduce, right? We love to have our skin looking nice, right? So we love that collagen, and who wants wrinkles, you know, but it comes with life. So those are positive things, but there are some cells that overgrow and they don't stop growing. And when they grow out of control, and if they are cancer cells, that's when you're going to start having a lot of issues. So basically, breast cancer or cancer in general are cells that grow out of control, that are not good ones, that are malignant. And also they can be benign, but a lot of times they're more malignant.
What are some of the symptoms that you got?
The first time, I just went to the doctor, the GYN, maybe about 2 weeks before, and she gave, you know how they give you the breast exam, if everything was fine. I went home and a commercial came on and said, did you do self-examination? And at the time I was with my friend and he wanted to do it, and I asked, he asked, and he felt the lump, and that was the first time. And from there I went and they did a needle aspiration, and that's when they found out I had the cancer, triple negative.
Nila, what were some of your symptoms?
I actually didn't have any symptoms. I just went for a routine mammogram. But I mean, I have a little bit of a story about that. You know, in April of 2017, I got a normal letter for my mammogram, but the doctor that I normally went to was no longer took my insurance. So I started looking around for different doctors, and, you know, just like the pain of insurance that we face a lot, you know, a lot of doctors didn't actually take the insurance anymore. The ones who I checked, the ones who recommendations I got. And then, you know, so I tried looking like for about 2 weeks, and I remember being frustrated about it. So then, you know, I have other things to do too. I'm working and I'm a mom. And then in June of that year, I knew I had to pick it up, but then so many other things kept on, you know, coming as a priority. And then in June, somehow I kept seeing a man. I saw one man who looked like my dad. My dad passed away like 3 years before. And then a week later, I saw another man who looked like my dad. And it was so uncanny. I actually went up and spoke to these men because they looked so much like my father. And then I saw a third man who looked like my father. And I remember telling my sister, I keep seeing all these people who look like daddy. And I made a joke and said, I hope I'm not going to meet him. And so I just decided, somehow it just made me think about the mammogram that I had left on the back burner for the last couple of months. And I went and I found somebody who would take my insurance, and then I got the mammogram done, and then I had breast cancer. I did not have any lump or anything like that, and I'm typically a healthy person.
Dr. David, other types of breast cancer and am I at risk?
Yes. So everyone is at risk of breast cancer. And it's not only women, you know, there's a high incidence of men getting breast cancer. Remember that cancer is a overgrowth, out of control, level of cell growth, right? So anyone can have that, females or males. Now, I believe from research that I've read and also conferences I've gone to, that years and years ago, men did have breast cancer. However, it wasn't something that was very easily reported because it's such a female problem, right? However, as the years and, you know, the more modernization that has occurred, more males have been diagnosed with breast cancer. But yes, all of us are at high risk, not high risk, but are at risk for getting breast cancer. Now, there are some that are more high risk than others. For example, if you have obesity. So obesity is a major contributing factor to getting cancer in general, because people that are obese hold into a lot of estrogen in the fat cells, and estrogen is literally considered the food source of cancer cells. So if you look up like people that have had certain types of cancers, particularly when we're talking about breast cancer, some of them have a BMI greater than 25 because of the fat cells take in that have that extra estrogen on top of the estrogen that you already have. Also, it has been found that people that work night shift work have a more propense chance as well of getting breast cancer, some type of cancer, because at night, the body is used to like regulating itself, like basically like a reboost itself. And there are some things that do happen when you are in that REM sleep that are not happening when you are working night shift that will help you avoid certain cancers. So yes, all of us are at risk of getting breast cancer. No one is excluded.
How do we stop these cells from growing?
Well, unfortunately, for us personally there's nothing that we have found that will stop the cells from growing unless the person goes through a series of treatments that may include radiation and chemotherapy. Or ultimately, when they're going to have the breast removed, which even when they do that, they still will have to go through the treatment, like either radiation or chemo. So depending on what treatment their oncologist chooses for them, that's best. Because remember that it's not, okay, let's say I have breast cancer and take that breast off, I don't need it, let's get treatment. It all depends on the health of the patient. So do they have any kidney problems? Do they have any liver problems? You need to have good kidney function and liver function in order for you to basically excrete that chemo, that treatment out, right? Because although you want it to do the function, you don't want to stay with all that, which is a toxic, right? Because remember that chemotherapy doesn't know, oh, this is the cancer cell, let me target that, right? That's not how it works. How it works is that you get chemotherapy and your radiation, and it's going to try to kill every cell, the bad ones and the good ones. So it does not know. I mean, it would be great, right? If we can create something that says, I know where that cancer cell, let me target it. But unfortunately, that's not how it is. So you should have some level of health, kidney function that's good, liver function that's good, in order for you to be able to sustain this treatment that is so, I mean, it's pretty strong. And from our cancer survivors here that probably have gone through some of those treatments can tell you that it will affect not only you, but everyone around you, because there are some special precautions that have to be taken, not to mention the support, which is key in patients really being compliant with those treatments, because some people after one treatment want to quit because it's so strong, right? Like they can't eat, maybe their throat is burned, their mouth is burned. So it all depends on the individual, which treatment is chosen and what's best for them. But knowing that they need to, if they know that they're going to start that treatment, they need to kind of prep ahead of time. I always tell my patients, fatten up. I know that, it might be contraindicated in some, but when you're going through these treatments, you're going to lose a lot of weight. So it's good to have that mass that's going to sustain you in preparation for, but also and I cannot stress this enough, the emotional support that you have to have pre this process during and after, especially when you are in that remission stage, because you're always going to be paranoid. Oh my God, do I have it? Look, our panelist Levette had it twice. I mean, who wants to have it one time, right? So it's a forever and ever support system.
How often should I be screened for breast cancer?
So that is actually an excellent question, because there's different beliefs, and then there's insurance. So, you know, it's supposed to be annual mammograms. But as you know, depending on your insurance carrier, some of them are saying, no, you can do it every 2 years if you're at low risk. Or I've even had a patient that said that their insurance wasn't covering it until every 3rd year because they're considered so low risk. Yeah, so that was a big eye opener. But the preferred is every single year. I'll tell you, I turned 40 last December. And I said, I have so many things, and I'm involved in so many things that I said, I have to pick a day that I will never forget. So I said, on my birthday, every year, I'm going to be scheduling my mammogram. So exactly on 12/19, don't forget it, December 19 is my birthday. I had my mammogram last year. So this year falls on a weekend. So guess what? That following Monday, the 21st, I'm going to have it. So I know that that's a period that I should have it. So yeah, the recommended guidelines is a yearly mammogram. But again, depending on your insurance carrier, it might be different. And then there's others that, and this is where a lot of people get stuck on, because it depends on their beliefs. Some people believe in mammograms, right? They want to just resort to their self breast exams, which is perfect, right? We want to do that in addition, because our self breast exams, some of us don't even do it right? We're trying to get it done, but do we really do it right? Okay, so we need to make sure that we have something that can detect these cells that our hands cannot.
How old do you think we should take when we go for our mammogram? How old should we be?
So you should be 40 years and older. However, if you are considered high risk, for example, I know Levette and Nyla, they probably in the beginning, patients are getting them sooner. Okay, or maybe they never got a mammogram before, and then they're 60 and they get it, and oh my God, here we go, there's a problem. So the age is 40. However, if you're considered high risk, like if you have a parent that have had cancer, specifically like, you know, your mom or father, even if you have a grandparent, that can be true, but specifically your parents, they will usually do one sooner than the 40 years, especially if it's something that runs in the family. Like I know someone that the aunt had breast cancer, the grandmother had breast cancer, her own mother had breast cancer, and all 3 died of breast cancer. So she started getting mammograms at the age of 18. So you see what and they had aggressive breast cancers. So in a perfect world where you're not at high risk of breast cancer, because maybe there's no one in your family that have had any, you know, there's really no issues with you, they'll start at 40. But when there is a problem within your family, something that's genetic, you know, it just runs in your family type of thing, or your direct parent, they'll start earlier.
Levette?
Yes, my mother had breast cancer twice, so that's why I was tested to do at age 38. So yes.
What is the Sister Network? How does it help?
Well, the Sister Network is a bunch of women survivors, and we can have some that are non-survivors but have family members that are survivors that are here to support, comfort, educate, do whatever we need to do to make sure the knowledge of breast cancer, what you need to do, how you need to get tested, the information is given out to everyone.
Nyla?
Yes.
How has the Sister Network helped you?
You know, it's helped me in a way that I just want to be a part of the community that contributes to the education. Now, Black women die at a higher rate, a faster rate or higher rate than any other race for breast cancer. And it's a very disheartening statistic. And it's for a number of reasons. It's because of the genetic, the makeup of some of Black women, their tumor biology. The Black women tend to get a particular breast cancer called triple negative, which is more aggressive. It's also a lack of information, a lack of socioeconomic factors. It's also the fact that culturally, Black women, some Black women prefer not to know, or they pray it away, and they think just by praying it will, it might actually have the breast cancer gone. And of course, that's an important part of healing, but there are other things. There's a medical side of things as well. So for me, and the other thing too, when I was diagnosed, I didn't see anybody who looked like me. So, you know, when you go through the Google and you go through all the forums, and, you know, you tend to look for people who look like you. You tend to look for people who have had the same diagnosis as you. And so, you know, for that, I actually started a page on Instagram called The Breast of Us. And that page, I have Black women from all over the world, just showing, just in one place, so you can actually see, so Black patients, Black breast cancer patients can see themselves. And that's just one thing I did at The Breast of Us, that Instagram page, but I also wanted to do more. So when I was presented with the opportunity of being a part of Sisters Network, I mean, it's something that I just could not do, just because I just wanted to do more for the Black community.
So I noticed that you spoke about genetics. How does genetics play a factor?
Yeah, so yes, so for me, genetics is the people who, breast cancer patients, or I should say, let me say it like this. Genetics actually make up about 5 to 7% of breast cancer patients, the reason why patients get breast cancer. So they're different. I did a whole profile. When I was actually diagnosed with breast cancer, 6 weeks before, my mom was diagnosed with ovarian cancer. And so we were both, we both had cancer at the same time. I had breast and she had ovarian. And she also had breast cancer 10 years prior. So what we did is that we did this genetic profile test, and it looked at a number of different genes, and the BRCA gene mutation we were found to have that mutation. So it's something that I'd like to actually talk about in a presentation that I have. So if just give us a couple of seconds, and Mariah's going to help me pull up that presentation. Right, can you put it in presentation view? Okay. So before I go into it, I want to talk about my family. Just enter Mariah. Okay, so my family consists of my dad, my mom, and they have one daughter, first daughter. Then the second daughter, that's me. The third daughter, a fourth daughter, and a fifth daughter. So my parents have 5 daughters. Okay, you can enter, Mariah. So let me talk about our cancer health history. So my dad unfortunately passed away in 2014 from prostate cancer. And my mom had, 15 years ago, she had breast cancer, and in 2017, she also had ovarian cancer. And then, of course, and then there's me, and I had breast cancer in 2017. So then, and this is our BRCA history. So as I mentioned before, my mom was BRCA2 positive. And then I was BRCA2 positive. So hang on a sec, Mariah. So I just want to talk about this for a sec. So based on the fact that we were both BRCA2 positive, and given the fact that I have a number of sisters, there's a doctor at New York Presbyterian who offered to test my sisters and to find out what their status, what their BRCA history or BRCA status was. And, you know, it was very kind because my sisters live overseas in the Caribbean as well as in England. So she sent the tests over for them to do, and based on the test, there was some of my sisters, let's see the willingness of my sisters to actually do this test. Just want to enter, Mariah? So my first sister said yes, she was willing to do the BRCA test. My third sister said yes. My fourth sister was willing, but my fifth sister was not willing. And I just want to talk about this here. It's not everybody is interested to know what's happening with them. You know, there's a bit of a fear. There's a bit of a, well, what would happen will happen. There's also a bit of, well, I don't think anything is going to happen to me. Okay, but what we did is we convinced that sister to actually do the test. So let's see which sister tested positive out of all of us. So my first sister, she tested negative. And then there's me, I'm positive. My third sister, she was positive. My partying sister, negative. My last sister, she tested positive. Okay, so now you can go to the next slide. So now what? What do we do now with this information? Okay. Now with breast cancer, with BRCA2, with the BRCA2 mutation, I just want to say everybody has the BRCA gene, but what affects us is the mutation of that particular gene. So with the BRCA2 gene mutation, this is our elevated risk of cancer. So we have an elevated risk of breast cancer. We also have an elevated risk of ovarian cancer. There's an elevated risk of pancreatic cancer, also melanoma, and with some geneticists I've spoken to, also thyroid. Now, breast and ovarian are the highest risks. Across the lifetime, breast and ovarian, it's more than 50% elevated risk of cancer when you have that mutation. I think pancreatic cancer, you have an elevated risk of, let's say this normal standard risk of the general population to get pancreatic cancer is about 2%. With the BRCA2 mutation, it increases to about 5 to 7%. Okay. So what do I do with this knowledge? When you have the BRCA2 mutation, what people need to do is to get mammograms and ultrasounds annually. Now, this is once per year. You get your ultrasounds and mammograms, and you also get your breast MRIs annually. So basically what's advised to do, you space those two types of imaging out. You space it out, by 6 months. So every 6 months you get either a mammogram or breast MRI within the same year, so that you end up having, each one is once per year. So you end up having 2 different types of images within a year. Okay, or you can have a prophylactic mastectomy, and that's what I had because my breast cancer was on my right side, but I opted to do a double mastectomy because of my increased risk of breast cancer. Okay, the second, in terms of ovarian cancer or the risk of having ovarian cancer, you can do blood work. There's a test called CA125. And you can also do, and I'll talk a little bit about that just now. You can also do ultrasounds, and if you're finished having your kids or you're past childbearing age, then you can opt to have a prophylactic oophorectomy, and that's the removal of your ovaries and your fallopian tubes. Okay. Let me go back to, I just want to, before I go to pancreatic, I just want to talk about the blood work for ovarian cancer. There are, it's a blood test that you can do to see whether you have, they can detect whether there's an elevated cancer profile. But I have to stress that these tests, these blood tests are not reliable. They are not to be relied on solely. Because it can give you a reading. It may not actually pick up that you have cancer, and when it does have a more elevated reading, it means that the cancer is already so advanced. So it's definitely the test that you should actually use for ultrasounds, and for ovarian cancer, ultrasounds. And doing a prophylactic oophorectomy, if that's your choice. Okay. With pancreatic cancer, you can do endoscopic ultrasounds annually and alternate with MRIs, and that's what I do. So I have one once a year I have an endoscopic ultrasound. It's a very simple procedure. You go under just a mild sedative, and then the next day I do an MRI. So I have a gastroenterologist who's my specialist for that. For melanoma, there's an increased risk of melanoma. So what I do is I have an annual skin check with my dermatologist. And what I also do is I use sunscreen. I mean, everybody should wear sunscreen anyway, even though we're a Black woman, it's skin is skin. So you should wear sunscreen. But I wear sunscreen, and I also wear like long sleeve swimsuits if on the beach. Okay. And I make sure to have a hat, and just to keep myself shaded and not too much in the sun. It's hard sometimes, because I like the sun, but these are the things I just have to be very careful of. In terms of the thyroid, I have a thyroid check annually. I do a thyroid ultrasound, and I also get blood work done to test my thyroid levels. Okay. So and the other thing is this information can impact my children. So I have two children. I have two girls specifically. So it's not legal, or I'm not able to test them while they are minors. They could, and because the law prevents parents from actually testing their kids if the parents themselves have found to have a mutation, and that's because they don't want parents to make a decision on a child's life, or to have that anxiety about a child's life. So when my kids are, I think it's about either 18 or 21, they can find out about their profile, and then they would have some options presented to them. I have actually a babysitter. She is also she's BRCA positive, BRCA1 positive. She's in her 20s, and she recently actually had a double mastectomy just because of her increased risk. So there's a group of people called previvors. So they're not survivors, but they're previvors because they've done some prophylactic, taken some prophylactic measures because of the increased risk of cancers. So, and then the next thing I want to do, this is you can do another enter, right? I actually wrote a children's book, and I don't know why it's not coming up, but maybe if you do it, maybe Mariah, okay. It's called Mama's Afro is a Soldier Too. It's nothing to do with genetics per se, but I actually wrote this book because as a mom, I decided that I was going to tell my children about the fact that I had breast cancer because of all the changes that would happen over the next year. but I didn't see any books. There are a couple of books around, but I didn't see any books who had a mom that looked like me. And for me, because my kids were that young, it was really important for me to have them see a mother in the book, a Black woman in the book that represented their mother, so they could understand that that person is not just a fictional character, but that person was representative of their mother and me. So I wrote this children's book, and it's going to be available for pre-order soon. And I just hope that a lot of I hope it's useful to a lot of Black women. But you can check out my social media just to find out more about the book. The N.M. Charles author is the first one that I've just created recently about the book. At the Breast of Us is the one where you see a lot of Black women who have breast cancer, and I just hope I'm doing my part to help Black women in the fight against breast cancer.
Thank you, Neila. Dr. David, we have 2 questions.
Okay, go ahead.
Okay. Who in the family should receive the Barak test? My doctors recommended that the Barak test for me is due to my mom's breast cancer. However, my insurance did not approve of it and is indicating that my mom should take the test.
So a lot of that is a common issue. Okay, so they want to make sure, because everyone, how Nyla said, has that gene, but do they have the 2? Okay, that's the difference, which is the mutated version. So they will require the person that is directly related to that person to have that same test. Because remember, not everyone has that test, okay? Sometimes they don't. Sometimes, there are people that don't have insurance. Okay, so we have to face that there's millions of people that don't have a way of paying for these exams to even get a mammogram, right? I mean, imagine paying a mammogram. I mean, I don't even know how much that is, but I know that when you get IV fluids in the emergency room, that runs a couple $1,000s. So I could imagine a mammogram, the cost. So yes, so in a lot of cases, in order for them to confirm that that is in existence in that relationship, they would require that person to get that exam before allowing you to get it. And I know that it's not right, but unfortunately, insurance companies make their own policies. It's not something that healthcare providers do.
I have one more question.
Yeah.
Nyla wants to expand on that, I think.
Yeah. I think Levette wants to say something. Was that Levette first? If you don't have, let me just talk about and expand on what Dr. David said. The genetic test, yes. So it's a pain. For me, I think when I was diagnosed with cancer, I would say my 2 biggest pain points were the cancer and the insurance company. I was constantly on the phone with the insurance company. But I could tell you this, and do some research. But there is a company called Counsel. It's COUNSYL, and they did my genetic testing. Now, I got referred by my doctor to do this test through them. But I did actually have a conversation with their geneticist or their administration team, and this was 3 years ago. And what they said is that if you can get, basically the test is about $300, and if you can get any doctor to just refer you to that test, then you can get, any doctor in the US can refer you to get a genetic test, and you can get that test done. So maybe your PCP doesn't do it, but maybe you can get another doctor to refer you. So maybe it has changed, but it's something, but it's useful. And the thing is, Counsel does not only, they would ask you what kind of genetic tests you did. Like I did about 13 types of genetic tests. There's not just only the BRCA2 gene that increases your risk for breast cancer. There's another gene called a CHEK2 gene, which is it also increases your risk for breast cancer. So even if BRCA may be if BRCA may be negative, there may be other genes. And the thing is, they're very, very good, because the geneticist is going to call you and talk about the results and talk about what your results mean for you and your elevated risk of cancer. So, you know, call that company counsel, and then, you know, and then speak to another doctor to see if you can get a referral.
Dr. David?
I'm here.
Okay. What are the types of treatments you can get?
So different treatment plans are pretty simple. And using simple, not literally, but it's just, there's three things. One, you can do the prophylactic version of, let me remove my breast, right? So some people have a hard time with that, okay? You know, and it all goes with how you feel as a woman, and understandable, but know that when you have this procedure, eventually when you get better and then they put expanders, you can have implants in if you want to. So that's kind of like a positive part. I mean, I'm all for that, right? You know, that's like a positive. You have to always think of a positive piece to this bad thing. Then you have the option of radiation, and you have chemotherapy. Okay, so depending on the choice, and remember what I said in the beginning, the health of the patient, their kidney function, their liver function, will they be able to sustain these treatments? Does their insurance cover it? Because it ultimately also goes with what insurance you have, and it's unfortunate, but that's what it is. Unless you have the funds to cover for this, more power to you. But those are the treatment choices. Depending on the one you choose, you know, we'll say, okay, your remission time will be this. Now know that when someone decides to get a mastectomy, that they remove their breast, whichever breast they remove or both, they will still have to get either radiation or chemo. That's just one of the things that you could do, because did the cells, you know, go somewhere else? Like we really don't know if they've traveled, if they've metastasized. So they have to really give you that treatment on top of that mastectomy that you chose to have.
Hi. If Mariah, if you could pull up. Thank you so much. All right, so we just really want to give a super big thank you to the panelists. Thank you, Nijah, for hosting this. This was really informative, was so incredible, was so amazing. So we have some certificates for our panelists, just to give them a special thank you. So Alpha Kappa Alpha Sorority Incorporated, Eta Omega Omega Chapter, Bronx, New York, Certificate of Appreciation to Nyla Charles.
Oh, thank you.
Levette McEachin, and Dr. David, in recognition of your participation of our 2020 Breast Cancer Awareness Day panel and your role in advancing health promotion for the Bronx community. This is presented on the 5th day of October in the year of our Lord, 2020. Thank you so much.
Thank you so much.
Thank you.
And in closing, I would like to go to Levette. If you can please speak more on the sister network, when do you guys meet, any other resources or information you guys provide as well.
Okay, System Networks, we have a Zoom meeting at least once a month that you can join. Anybody can join, and we discuss what issues that the members may have, what issues other people may have, share information. And we are working on the Facebook. We have an Instagram account, and we will share that with you. And that's it.
Eta Omega Omega Chapter of Alpha Kappa Alpha Sorority Incorporated would like to thank all of the panelists for sharing your experiences, your knowledge, your information on prevention and detection with us today. Special thanks to Dr. David, Levette McEachin, Nyla Charles for sharing your stories and sharing your knowledge. October 16th is Mammogram Day. We are expecting, if you don't have a date set like Dr. David, December 19th, please, October 16th, Mammogram Day. Again, thank you for sharing this time with us. To thank our committees, both committees, Eta Omega Omega Chapter's Breast Cancer Awareness Committee, chaired by Trisha Griffith and Nijah LaCourt, and to the Sisters Network of New York. Thank you.
Thank you all. We will be having this video on our Instagram and Facebook. Thank you all for joining and have a good day.